Grace. I'm going to be your nurse today.
Okay.
We're going to be doing a full head-to-toe assessment on you.
Okay.
So I'm going to give you some privacy, but I would like you to put this gown on for me.
Okay.
Before we get started, if you would just verify your full name and date of birth for me.
Olivia Windsor, December 4th of 98.
Thank you so much.
You're welcome.
And I'm going to step out for a moment, let you put this gown on. You let me know when you're ready, okay?
Perfect. I'm ready.
Okay. All right. First thing I'd like to ask you today is your height and weight.
I'm 5'10" and 175.
Okay, great. Thank you so much.
You're welcome.
I'm going to grab your temperature. Okay, great. And if it's okay with you, I'm going to get some vital signs, okay?
Yeah.
The first thing I like to start with is your blood pressure.
Okay.
Do you have any reason why I shouldn't use your left arm?
No.
Okay. Okay. I got about 120/80. And I'm going to count your pulse rate. I can see your wrist. Okay. I got about 70 beats a minute, and I counted your respiration as well as doing that, and I got about 15 breaths per minute.
Okay.
And I'm going to write that down over here. And are you having any pain today?
No.
Okay. Can you tell me where you are?
I'm at Capital Region Hospital.
Okay. Can you tell me today's date?
It's December 5th, 2019.
And who is the president?
Donald Trump.
Awesome. Next thing I would like to assess is your skin. So if you could pull your sleeves up for me.
Yep.
Thank you so much. Let me look at your arms. Warm, pink, and dry. No rashes, lesions, or any skin integrity breakdowns. Turgor is good on both hands. Capillary refill is under 2 seconds, which is perfect. And I would like to assess your face next. And I'm looking at it. It's symmetrical. Your features are proportional, and your skin is intact on your face and your lips. And I am looking at your scalp. And are you having any tenderness?
Nope.
Okay. Your scalp looks healthy. Hair is soft and evenly distributed. And do you have any pain or pressure on your sinuses?
Nope.
Okay. Can you occlude one nostril for me? Breathe in, and then the other one. Okay, great. I'm going to do your eyes next. But actually, before I do that, I'm going to feel for a couple of pulses here.
Okay.
Right now, I'm feeling for your temporal mandibular, your temporal pulse, and your TMJ joint. So you can open your mouth for me and close it. Okay. Any pain when you do that?
Nope.
No. Okay. And your pulse is intact there. And for your eyes, you can leave your glasses on for part of this, but I'm going to check your pupil equalness, reactivity to light, and so I'll need you to take your glasses off just to avoid any glare. Okay, great. And
They can bring them
let's
to
see.
practice.
Oh, okay.
And then I can collect.
Okay.
If that helps.
For your eyes,
I'll come see you back later in a while.
Okay.
And I would like you to, this is called the Snellen chart.
Okay.
And I'm going to measure, make sure we're holding it a correct amount of distance. If you pull it just like an inch closer to you.
Okay.
Tell me which line you're reading and read it to me.
The bottom line, 426,739.
Okay, thank you so much. Yep, it's perfect. That means you have 20/20 vision, and if you would follow this pen light just with your eyes, not with your head,
Okay.
just to make sure we're assessing that your eye muscle movement. Okay, great. And I'm gonna put my fingers behind your head and bring them forward. You tell me when you can see them, and then I'm gonna hold them in 3 different positions. I'm gonna ask you how many fingers I'm holding up.
Okay. I see them.
Okay.
2, 1, 3.
Okay.
1, 2, 3.
Okay. And follow this pen light with your eyes. Great. Thank you so much. And can you smile for me really big? And then I'm going to squeeze your eyes shut. You're okay, you can leave the glasses on. I'm going to try to open them, hold them shut. Okay, great. And let's see. I would like to assess your ears next. I'm looking at the inside of your eye, your conjunctiva, and it's pink, it looks healthy. The sclera of your eyes are white, which is great. I'm going to do a lever test, so I'm going to hit this so it vibrates. I'm going to put it on your head, and then tell me if you feel it and hear it equally in both, okay?
Okay. I hear it equally in both.
Okay, great. I'm going to do this again, but I'm going to do it behind your ear. Tell me when you feel it, when you stop feeling it, and then when you hear it again, okay?
Okay. I hear it.
Okay.
No, I don't hear it. I hear it.
Okay.
I hear it. I don't hear it. I hear it.
Okay. Great. And assessing your ears, they look intact from the external view? Do you have any tenderness or pain when I touch them?
Nope.
Okay. And I'm gonna take a peek inside.
Okay.
I'm gonna be pulling your ear up and back. And what I'm doing is I'm assessing your eardrum, it's your tympanic membrane, and it looks pink, smooth, and shiny, which is what we want. Okay, great. And then I'm gonna do a couple of tests on your hearing.
Okay.
I will, so these were 2, and then I'm going to whisper, I'm gonna have you sit here, hang your legs over the bed, and I'm gonna whisper letters or numbers behind you, a series of 3.
Okay.
And I want you to agitate your finger in one ear and repeat back to me using only the other ear to listen, okay?
Okay.
Okay, doing your right ear first.
J2C.
Great, and now your other one.
AV1.
Awesome. Okay. I'll be assessing your mouth next, continuing on with your face. Your lips look great, not chapped, proportionate to your face. If you would open up for me, tongue, buccal mucosa intact, teeth are intact. Can you open up one more time? Can you say ah for me? Okay, uvula and tonsils are good. Hard and soft palate is intact. Next, I want to look at your neck.
Okay.
It's symmetrical. I can feel your carotid pulses. I'm feeling for any lumps, bumps, or bruises. Your skin is warm, pink, and dry. I will palpate and make sure we're not feeling any swollen lymph nodes, and I'm not feeling any, which is perfect. I'm going to step around behind you,
Okay.
and I'm going to make sure your trachea and your thyroid are midline. Can you swallow for me? Okay, perfect. Thank you so much.
You're welcome.
All right. And let's see, while I'm assessing your neck, I want to make sure that all your vertebrae are working correctly. So if you can just lower your head and lift it up, and then side to side. Okay. And then tilt it to your shoulder. Perfect. And I'm going to be listening to your lungs and going to be just kind of feeling, making sure everything's good there. So
Okay.
I'm going to look at your chest overall, and your chest shape is good. No barrel chesting or anything like that. And take a deep breath for me. Okay, great. Symmetric lung expansion. I'm looking at the skin on your back. No rashes, lesions, bumps, or anything like that. Let's see. I'm gonna listen first to your lungs, okay?
Okay.
So if you just take some deep breaths for me. Okay. Now that I listened, you're gonna feel my hands on your back. Every time you feel them, if you would say 99.
99, 99, 99, 99.
Great. And you're gonna feel me doing a little percussing. This is just to make sure there's no fluid buildup in your lungs. Okay, feeling great. Healthy lungs. Getting lots of exercise. And your breath sounds were clear. When I listened to your respiration rate earlier, it was 15, which is an appropriate amount. And your lung sound clear. It doesn't sound like you have any labored breathing, which is great. And now I'm kind of going to repeat all of that on the front of your chest.
Okay.
So again, assessing the shape of your chest. It looks like appropriate. No lumps, rashes, lesions, anything like that I should be concerned about. I'm going to start with listening to your lung sounds.
Okay.
Okay, great. Clear. And then I'm gonna do I'm gonna do percussion to make sure again we're not feeling any fluid buildup. Okay, awesome. And breath sounds are good. You don't have any pain or tenderness, no issues with breathing, correct?
Nope.
Never woken up at night gasping for any of that. Okay. The next thing I would like to listen to would be your heart.
Okay.
And what I'm going to be listening for murmurs or abnormal sounds. And the first thing I'm going to do is I'm going to palpate. Okay. And not seeing anything abnormal there, I'm going to listen before 4 plates. And then the point of maximum impulse here. Perfect. And then I'm going to have you lean forward while I listen to that. Great. And then lay on your side for me. Excellent. And no issues there. Have you had any issues with your heart racing or palpating?
Nope.
Okay, awesome. The next thing, while we're kind of here, I want to make sure you can move your arms and upper extremities appropriately.
Okay.
So stick your hands out towards me, palms up. Pull. Sorry, just pull your wrist towards you. Okay. I'm not being clear. Stretch your. Pull your lower arms towards you. Resist me. There you go.
Oh.
Push away. There we go. And just kind of bend and extend. Okay, great. Stick your hands out. Just do this and touch your fingers. Okay, great. And I want you to reach around behind, touch your hands, and then the other way. Awesome. And grip strength. Squeeze my fingers for me. Stretch your fingers out. I'm going to try to push them in. Don't let me. Don't let me. Do this. I'm going to try to push them down. Don't let me. Pull them up. Awesome. And next, I'm going to have you lay down. I'm going to listen to your stomach. And contours of the abdomen are flat. Umbilicus is midline. Do you have any tenderness or pain?
Nope.
Okay. I'm going to listen first. I'm going to listen to all 4 quadrants. Usually want to listen for about 1 minute. We're gonna say vowel sounds are normal active. And I'm just gonna feel a little bit, okay?
Okay.
Do some light palpation, and then some deep palpation. And then if I was concerned about your liver, I could go from the back, make sure that was in place. And it all feels great. And your bowel sounds are normal. Skin is warm, pink, and dry. No lashes, lesions, rashes, lesions, or bruises.
Okay.
Which is great. And we're going to be doing your lower extremities now. I'm going to look first. It looks like you have good blood flow. Skin is warm, pink, and dry. No shininess, no hair loss, no edema. Pulses on the back of your knees, 2+. And normally I would be feeling her pulses on her feet with her socks and shoes off. Okay, that looks great. We're gonna do range of motion for your legs now. So if you'll swing your feet over the bed. Okay. And actually, I'm gonna have you get up.
Yeah.
It's okay. Okay, start there. I want you to just extend and then bend back your hip and then go out and then in. And then do that with the other leg. Forward and back, out and in. Awesome. Bend your knee for me. Other leg. Kind of wiggle your foot up and down, side to side. Any pain?
Nope.
Nope. Awesome. If you would walk towards me normally and then walk back. Great. And then do that again, but do it putting one foot on the other, acting like you're walking in a straight line. Great. You don't have to walk back like that.
Okay.
And if you would bend over for me, touch your toes. I'm assessing your spinal processes. Great. No scoliosis. Awesome. Stick your hands out towards me. Palms up. Close your eyes. Perfect. Good balance. Have a seat. And let's see. I'm gonna do your reflexes next.
Okay.
And I'm going to just hit my thumb here, and we're looking for a thumb twitch. Great. And we're going to hit right here, looking for a reflex there, and then here. Great. Reflexes intact. And then I would like you to show me some fine finger movements. So do this for me. Awesome. Touch my finger and touch your nose. Great. Good stuff. And we need to make sure you have sensation across your body.
Okay.
So I want you to close your eyes. You're going to feel me touch your cheek, your arms, your hands, your legs, and your feet. I want you to tell me hot or cold, sharp or soft, or vibration. Okay?
Okay.
All right. Here's your first one.
Soft.
Okay?
Sure.
Okay.
Cool. Warm.
Great.
Vibration.
Great.
Sharp.
And then I would do this on the feet as well, making sure shoes and socks are off. And I would also assess the plantar flexion of the foot by running this up the base of the foot, wanting the toes to curl for health. So do you have any questions for me today?
No.
Okay, great. Well, I would encourage you to eat a heart-healthy diet, lots of exercise. You're young, make sure you keep your stress level down around finals week. And is there anything else I can address with you today?
No.
Okay, great. Do you have a spin around the room? Okay,